Thank you, Simon, for that very nice introduction. I'm really humbled to be here, and I feel lucky that I've been invited to speak on oral health and low-carb, healthy fat nutrition. And that's quite important because the discussion of oral health is somewhat absent from a lot of the discussions around diet and diet-related disease. And a really good example of this was some years back in 2018 at the Food for Thought conference that took place in Geneva, and it was hosted by the BMJ and the global reinsurer Swiss Re. And they produced a supplement where at this conference all sorts of topics relating to macronutrients and nutrition and controversies and areas of agreement were discussed. Yeah, so here's the supplement. It was called Science and Politics of Nutrition. And so I thought, well, let's go and have a look and see if dental caries or any element of oral health is discussed in this document. Well, caries got 4 mentions. 2 of those mentions were in the whole entire document was the journal title Caries Research. Oral got 16 mentions, and this is quite exciting, so I went through the document looking at those. And here's where the text string oral appeared. There's an author called Celis Morales who was cited several times. And you can see the O-R-A-L occurred in all of these words here. Temporality, postdoctoral, none of which related to dental caries, which is the most common chronic condition worldwide. 3.5 billion people have untreated caries worldwide. It's increasing in developing countries. That's a fairly shocking figure. I've got some more figures relating to the burden of dental caries among young children in New Zealand. And so in New Zealand, 43% of 5-year-olds present with dental caries at age 5 at community oral health checkups. Those figures get worse because 60% of Māori children have dental caries, and it's even worse for 69% of children of Pacific Island descent experience dental caries, and they have a higher burden of disease where the average number of decayed, missing and filled teeth is 5, and that's just an average. Also, we have 7,000 children per year in New Zealand undergo surgery under dental anaesthetic for the removal of multiple teeth. The New Zealand taxpayer gets up every day to spend 150,000 New Zealand dollars per day on this surgery, which is entirely preventable, and that comes to a total of $37 million New Zealand per year. And that's what that looks like. It's a pretty ugly picture. I should have actually said, if you're a little bit queasy, look away now, but it makes for uncomfortable viewing. So what I'm going to discuss today is oral health and nutrition, and how caries is not only a local within-mouth response to the metabolism of carbohydrates, but also systemic inflammation and inflammatory pathways which are mediated by hormonal and metabolic responses are also implicated in the etiology of dental caries. We'll also discuss preventive strategies, and as Lucy said, we're at a low-carb conference, so I'll use a particular focus on dietary prevention. We'll look at the current strategies around that with regard to dietary guidelines and health promotion in this area, and the implications and challenges for dentistry and medicine in preventing dental caries. So for a start, dental caries is typically regarded as the localised destruction of teeth via the metabolism by bacteria of fermentable carbohydrates. So what happens is we ingest some sugars. I've got a picture of some sugars up there, and you'll notice that they're Wheat Bix and biscuits and popcorn and that sort of thing. And that lowers the pH in the mouth to below critical levels of 5.5, at which point demineralisation of the enamel occurs. Dental caries is a continuum of the disease process, which starts off as white spot lesions on the tooth, at which point a dentist might say, you might need to keep an eye on this, to full cavitation, which requires restorative work. What happens typically then is we eat carbohydrates, or most of us might not, and that will contribute to the demineralisation of the tooth, but the flow of saliva And our dietary behaviour also enables, at early stages of the caries process, remineralisation of the enamel via the uptake of calcium, phosphate and some fluoride into the tooth. That also buffers plaque acids, reduces or increases the pH to neutral levels. So saliva is quite important in this, but also the dietary behaviour of few eating occasions per day. So, for instance, if you're engaging in between meal snacking, that's not going to help the process, especially if you're having those fermentable carbohydrates. And so we're having a continual cycle. So the progress from healthy tooth enamel to unhealthy tooth enamel is a net effect of the metabolism of carbohydrates, but also your dietary behaviour and the saliva in your mouth. That's all well and good, but it fails to account for the etiology of caries, by which we have an inside-out process, by which the tooth is nourished, and by where a high carbohydrate diet, particularly high in refined carbohydrates and with a high frequency of consumption, has an effect on the nutrition of the tooth. Now, in here we have your parotid gland, which is the largest of your salivary glands. Has two functions. It secretes saliva, but also secretes parotid hormone. And as Lucy referred to earlier, the hypothalamus really is the controller in this way, in that the hormone signalling via the hypothalamus has an effect on parotid hormone secretion, but also on the dentinal fluid flow, by which a tooth is nourished through the blood supply into the pulp via a dentinal fluid flow, and that's responsible for the inside-out nourishment of the tooth. So what happens when we consume or eat according to a moderate dietary lifestyle? So here we have the modern dietary lifestyle of a high and frequent intake of refined carbohydrates. There's glycolysis there and an increased production of advanced glycation end products, or AGEs. And the effect of this on the mitochondria in the hypothalamus is that there's increased oxidative stress and an inflammatory cycle, which leads to the downregulation of parotid hormone secretion, which then affects the dentinal fluid flow into the tooth. And therefore, and after that, you get a malnourished tooth, by which you've got a weakened tooth that's that much more vulnerable to enamel erosion and a compromised immune system within that tooth. So let's see what happens here and how this is related to general metabolic disease. So we've got the systemic inflammatory cycle involving glycation, AGE production, and reactive oxygen species production. We've got hormone dysregulation occurring both in the parotid hormone, but also it upregulates the production of insulin from the pancreas, leading to hyperinsulinemia. And then we see down here that that's also associated with leptin dysregulation, which is the dysfunction of your satiety hormones, which drives sugar addiction, because then we're not feeling full, there's increased food consumption at multiple times during the day. That's a dietary behaviour that leads to more acid production. So what we have is a dual process of dental caries, with an outside-in response of the carbohydrate metabolism and acid production, but an outside-in and then an inside-out process by which tooth malnourishment is weakening the tooth and makes it more vulnerable. Unfortunately, that's not really how dental caries is often considered with regard to prevention. There's various reasons for that. Essentially what we have is dental caries as a type, or symbolises the germ theory, where bacteria and viruses, for instance, are regarded as the origin of disease. And of course, way back in the late 19th century, we had various drugs and inventions for the successful treatment of infectious disease, and there were public health interventions such as water sanitation. But there was this growing idea that your health is a function of your behaviour. And some of that grew through the social hygiene movements that were led by the progressive reformers of the day, and anyone who's familiar with Belinda Fettke's work with regard to the Seventh-day Adventist Church will recognise this. So from these social hygiene movements, they're all into cleanliness, and from that grew the oral hygiene movement, and that was predicated on the premise that if you kept your teeth clean, you could prevent tuberculosis. And so there's this idea of a clean tooth theory, that if you kept your teeth clean, your teeth would be fine. Commercial influences came into play there. There were the oral hygiene strategies were invented, such as mouthwashes and toothpastes, and it's a really interesting story as well too. But also the sugar industry were really into this because they decided to go with the whole, you can eat anything as long as you clean your tooth, you'll be fine. And so then occurring alongside all of this as well too were dietary recommendations where fat was pinned as the culprit for chronic disease, and it sidelined sugar, even though we knew back in the 1920s that an intake of vitamin D rich foods and full fat dairy was protective against dental caries. So what happened then is the principal focus of caries prevention has been based around oral hygiene, because you can imagine if you're a dentist in the last century where fat was pegged as the culprit for disease, that would also mean that, oh well, now we've got to start recommending these sugars, and then we had to focus more on oral hygiene as a preventive strategy. So now we're going to look at the dietary associations. We know that sugar has long been associated with harm for oral health and caries. That's well established through time series analyses and studies of bacteria on teeth. With regard to other fermentable carbohydrates, including those carbohydrates that are not necessarily sweet, we know that the highly processed starches hold sugars onto teeth for a longer period of time, and they reduce the pH level in the mouth below 5.5 for longer and there's longer clearance times of those sugars from the mouth. So as part of my PhD, I did a systematic review looking at the effect of sugar and starch products on dental caries burdens. What we found was that increased caries burdens were associated with a high frequency of processed starch intake, and there were mixed findings on total exposures, which wasn't overly surprising because if we're eating starches at meals, we might also be consuming foods that are associated with protection against caries, such as dairy products and meat. Also, there were protective effects of other foods, such as full-fat dairy produce, and that's really worth looking into a little bit more. And I've popped in, this is the only nice picture here, this is cheese mounted on a block. It's a wedding cheese cake. So we know that dairy products are long been associated with benefits for oral health, for the buffering of acids and raising the pH of the oral biofilm to neutrality. But also for the nutrition of the tooth, it's the delivery of fat-soluble vitamins to the teeth, which are actually hugely beneficial. And we know that vitamin D is going to be discussed to some degree over the next couple of days, but I'll just go and focus on how it's beneficial for oral health. So it helps supply bones, teeth and muscle with calcium. The deficiencies in vitamin D, we know that children born to mothers who are deficient in vitamin D have an increased risk of caries, and they often experience poor enamel development. The teeth have in the dentin odontoblasts, and these are important in the formation of the dentin of the tooth, which is this area of the tooth below the enamel. They're also involved in immune function. They eliminate microbes that make their way through carious enamel, and they also repair damage to the dentin through the life course. They require vitamin D for the maturation of these odontoblasts that begin as stem cells, but also the regulation of these cells for immune function. And here are your vitamin D-rich foods. It's a nice picture as well too. But also, we do know some of you may have heard of the calcium paradox, and that sort of arrived from a study in which women were given supplements of vitamin D and calcium, but they finished up experiencing calcification of blood vessels. And so a few years back, about 2005, they discovered vitamin K2, which is an activator of the proteins osteocalcin, which enables calcium to be put exactly where you want it to be in the hard tissues, but also matrix GLA protein, which means that the calcium is not deposited where you don't want it in your soft tissues, like in your blood vessels. And there is a school of thought, and there's going to be more research in this area, which is quite exciting, about looking at the role of vitamin K2 in the build-up of what we call plaque or tartar in the mouth, because that may be an indication that there's some problems with calcium metabolism in the mouth, and which can have an effect on your saliva. But also we do know that the plaque on your teeth is actually calcified plaque. So the bacteria have always been there through all times in human societies throughout history. And here's your vitamin K2 rich foods, just in case. And so, including your grass-fed cow, which will convert K1 from the grass into K2 into the tissues, and that has a beneficial effect on your teeth, and also for regulation of the saliva in your mouth as well too. So with healthy eating advice, we wanted to know if the guidelines for healthy eating for children, for whom most promotion and or most of the preventive strategies around dental caries is aimed at. And does it reflect the evidence around the dietary risk factors for caries in children? Well, the short answer was no. The longer answer was not really, as I'm about to show you. What we did find that the eating behaviours of a high intake of refined carbohydrates and starch were the same as associated with obesity, but also that the guidelines make a recommendation. There's broad advice to restrict sugar intake and to consume a diet that aligns with dietary guideline recommendations. And we'll have a look at some of these recommendations, particularly as you click through from the New Zealand Dental Association website to some government-endorsed health promotion advice. And here's what that looks like. With bread and cereals, children need to eat breads every day, as are the best source of energy for the body. They include breads, breakfast cereals, rice, noodles, pasta, and they provide some vitamins and minerals. And how that looks, here's the servings. I'll point out the cup of cornflakes or rice bubbles, half a cup of cooked cereal, 2 plain sweet biscuits, whatever they are, cup of cooked pasta, noodles and rice, medium slices of bread. And if you're wondering how often they recommend children should have these per day, here we go. For preschoolers, at least 4 servings per day. And for school children, at least 5 servings per day. And for adolescents, they recommend at least 6 servings per day. And that came from the Ministry of Health endorsed guidelines. Then, given that we know that a high frequency of eating is implicated in dental caries, I decided to then we'll go and have a look at what they say about small meals and snacks. So children need to eat regularly during the day to meet their growth and energy needs. 3 meals and 2 or 3 snacks during the day. Think of them as a mini meal. Choose healthy fats that are low in fat, salt and sugar. And I'm going to show you some of these snacks. Sandwiches. Look at this, baked beans or jam. Spread margarine or butter thinly. Use bread, rice crackers, crumpets, pita bread, toasted muffins. Then we've got English muffins, crackers, fruit buns, scones, fruit bread, pancakes, and cereals that are low in fat and sugar. And my personal favourite is some popcorn, which you should pop with a little oil, margarine or butter. So it's all a bit confusing. So we really can't go blaming the kids for what their parents give them, but I don't think you can really blame the parents if they've gone to the New Zealand Dental Association website to see how they should feed their children. This is the advice that they're going to get that's been endorsed by the government. So we've got a few problems there and a few challenges there. So how does this apply to what people know about healthy diets? Well, as part of the PhD, I did a formative card sorting exercise where we got adults and health professionals to rate healthy behaviours. And some of those behaviours were brushing your teeth every day, visiting the dentist for checkups, eating meat, eating fat. And what we see is that the overwhelming majority of people regarded oral hygiene strategies as really important for the prevention of dental caries. We've got brushing your teeth, visiting the dentist quite often, eating vegetables, drinking plain water, eating fruit. The kids thought that was really important. The parents in the orange bar, lesser importance, and the health professionals didn't regard that as important at all. On the upside, eating carbohydrates, it wasn't something anyone thought about either way with regard to dental health. Eating less sugar, there was a fairly good appreciation that that was really good. But you'll notice the blue bars represent the children, and there are more children who think that they regard eating less sugar as important. But look at the figures for eating meat. Now, there's a few parents who regard eating meat as important for your oral health. Relatively few health professionals think that's important. Relatively few children. And then here's eating fat, including your dairy products, right here, where I've got this pointer. Very small portion of children think that's important. And the health professionals and the parents, well, some of them thought it was important, but they all thought that oral hygiene was far more important. So that's a bit sobering, isn't it? So we've got some obstacles in diet-focused preventive dentistry with this primary focus on oral hygiene, around which the evidence is considerably mixed. We've got dietary guideline recommendations. We've got a fragmented healthcare system where dentists are here, doctors are here, nutritionists are here, and they don't really talk to each other. I did speak to one GP, and the only time he'd see anyone in relation to poor oral health was if somebody brought their child in for the prophylactic prescription of antibiotics prior to going in for surgery for the removal of their teeth. We've got a reimbursement model which ensures that there's little to no chronic disease screening at dentistry, and medical doctors are typically not looking so closely at dental health, but also an ambulance at the bottom, the cliff treatment model, where most dentistry is around restoring or repairing damage. So the implications, there's 3 take-home messages: that a poor quality diet has detrimental effects on your oral health via systemic inflammation that's moderated and influenced by hormonal and metabolic pathways, and that's a really important thing to understand. But the good news is the low-carb eating lifestyle, which is characterised by high intake of vitamin D and dairy-rich foods, is protective or associated with protection, and that the prevention of caries is an impetus for the early intervention and integration of services. And we should probably be starting prevention earlier than when somebody's returning a test for pre-diabetes or an abnormal liver function or a blood test, because that's the beginning of end-stage disease. But it's really important to do this in children. I could leave with a really nice picture at that point, but if we fail to do anything about these rotten teeth, we're going to finish up with these amputated toes. It's a similar process by which these things occur. It's ugly, isn't it? It's really ugly, and those teeth are really ugly. They're not pretty pictures, and we should not be indifferent or be treating this issue with any sort of inertia, because we know that the experience of dental caries in children is very painful. It's associated with significant distress, but unfortunately it is part of a habit formation of eating frequently through the day and refined carbohydrates that lead to the damage that results in the amputated feet. Thank you very much.